You're getting back in shape now. You've got a whole new attitude. To get the most from life, you know what you've got to do. Join the Cardiac Fitness Club now. Oh, the feeling can't be beat. Oh no. And just a little exercise can get you right back on your feet. You're getting back in shape now. You've got a whole new attitude. To get the most from life, you know what you've got to do. Join the Cardiac Fitness Club now. Oh, the feeling can't be beat. Oh no. And just a little exercise can get you right back on your feet.
You're getting back in shape now. You got a whole new attitude. To get the most from life, you know what you gotta do. Join the Cardiac Fitness crowd now. Oh, the feeling can't be beat. Oh no. Yes, Dr. Schaman and his staff can help you get back on your feet. Ooh, yeah.
Heart disease is becoming more common as our society ages. Heart bypass surgery is now done more frequently in Canadian hospitals than appendectomies. But is bypass surgery always necessary? A doctor at a clinic in southwestern Ontario is promoting a non-surgical alternative. It's a clinically proven program to reverse arterial blockage without going under the knife. He heads up a group of patients who've decided to take the non-surgical route. They are the Cardiac Fitness Association. Dr. John Schaman operates the clinic in Breslau near Kitchener, Ontario.
But a heart attack as such occurs when part of your heart dies.
Gord Gilhooly is a loyal member of the Cardiac Fitness Association. He has twice experienced the trauma of a heart attack. I caught up with him on the treadmill at Schaman's clinic. He exercises religiously 7 days a week.
I have had 2 heart attacks. The latest one was just this last July. And I know that the intensity of the heart attack and my recovery time were greatly affected by the fact that this program has put me in a lot better shape than I've ever been in my life, actually. Well, maybe when I was a teenager, but...
Gilhooly is a sold-out disciple of Schaman's reversal program, which includes a stringent, ultra-low-fat diet.
I follow the Ornish plan, the plan that we use out here, and so I'm a total vegetarian and try and keep my total calories that I consume in a day at 10% from fat, no more.
The Ornish program for reversing heart disease was developed after clinical work by the American cardiologist Dr. Dean Ornish. As Schaman says, the idea that arterial blockage could be reversed without surgery used to be radical fringe medicine, but no longer.
These studies were amazing landmark studies in that they proved and showed for the first time in the history of medical science that atherosclerosis was actually reversible.
Al Lamb is in his 80s. He's been active and health conscious all his life. Despite that, he developed heart disease because, he says, of his eating habits.
But the thing that disappointed me then, that I was working out at the Y 3 times a week. I was swimming every week, playing badminton, square dancing, didn't smoke, etc., etc. But I guess you are what you eat, probably.
Some see Schaman's program of low-fat eating, regular exercise, stress management, and group support as being radical. He disagrees.
If you think about that for a minute, what actually happens with the bypass, I mean, it's pretty radical, really. You have to, saw through the breastbone and open up the chest and get into the heart and take veins out of the legs or arteries out of the chest and redivert them and detour them to supply the undersupplied artery of the heart. That's standard therapy. Well, I think that's pretty radical.
Schaman says many view a bypass as a fix, but he says that's not the long-term solution.
A bypass, on average, if you look in the modern medical world, statistics seem to show that a bypass only lasts 5 to 7 years. That's an amazing amount of heavy-duty surgery to only give you an average of 5 to 7 years.
Ed Granger has been a member of the Cardiac Fitness Association for several years. He sees Schaman as an encourager and a motivator.
I think what he does is to build in people that have a coronary problem a sense of confidence that maybe they can lick the problem. And that's what I find beneficial about it.
Schaman admits that motivating patients is not always easy. It requires a very costly commodity: time.
It may only take a matter of minutes to tell them that they need a bypass and to book it. But to make them change their life takes a tremendous amount of time and dedication and effort.
David Schmidt is one of those Schaman has managed to convince.
I think this is a lot better doing, what we're doing here than, getting all kinds of medication and trying to keeping our old lifestyle. We have to change our lifestyle to get better. We got no choice.
No heart bypass since, and I'm fantastically well. And definitely only by Dr. Schaman's directions.
Doctors tell Ed Granger he'd likely be toast by now were it not for Schaman's program. He says he benefits from the support and encouragement of others with the same problem.
You realize that you're no longer an isolated individual. You're part of a group, and there's a camaraderie to that, which is sort of self-supporting in your lifestyle. I think it's a very good thing.
You're getting back in shape now. You've got a whole new attitude. To get the most from life, you know what you've got to do. Join the Cardiac Fitness Club now. Oh, the feeling can't be beat. Oh, no. And just a little exercise can get you right back on your feet. Oh, yeah.